The topic of today is a coordinated care visit. The coordinated care visit is a different framework for Care Squared because, and the reason we have this new framework is because at Care Squared, we have launched a new brand. Just going to change the slides. Sorry. So Care Squared is our dedicated pediatric stream, and it's dedicated because it's supporting children with disabilities and their families. So that's the reason that we've also launched our new framework around coordinated care visit. What is a coordinated care visit? A coordinated care visit is especially designed to direct our services for children and their families. We know that families are and children and the outcomes that are measured and directed are very much intertwined. Our aim is to provide a comprehensive and coordinated service by understanding you and your child first. So support coordinators, this is directed, I guess, at you as well, understanding that you need to know the kind of service that you are directing your clients to. So the coordinated care visit, we aim to support the family and the child on the journey to reach the outcomes they want for their child by tailoring your services to meet the present goals. Goals change over time, and this is a continuous and cyclical process. We do this by listening to you, the referrer, or the family, and reviewing information you provide and coordinating the right professionals to match your therapy goals. So how do we support you on this journey? At Care Squared Kids, we know it is a complicated journey, and we are here to support you to make choices that facilitate your goals for your child. We know it's incredibly important to families not to have to repeat their story again and again when they change providers or service type. We know it's also really important to have a consistent contact person in your child's journey for your child and for you. And you need the right people around you to support you with your various goals. We also know intervention to support you on your journey with your child is far more beneficial to you than documentation about your child. So we don't want to, where it's unnecessary, repeat documentation or repeat assessments. We want to be able to rely on what has gone before with report writing and assessments to help inform and work with you to collaboratively form an approach to move forward for your child. So we have created a process to help coordinate your services, and we've called it our coordinated care visit approach. We are primarily seeing clients who have NDIS funding, and we also really value the NDIS early intervention funding framework. So we have ensured, and we are very much aligned with this early intervention funding framework. The intervention funding framework is, the outcome-based approach is around each participant receiving support that are outcome-based and goal-focused. Functional outcomes are central to our service, and the priorities are set by you. We document this intervention plan in collaboration with you and update regularly to ensure it continues to reflect your focus for your child in a way that is easy to understand. Capacity building is a term that's used consistently in the NDIS funding circles, and our services are designed to support capacity building category in early intervention. In early intervention, we ensure that the input we provide you aims to build knowledge, skills, and abilities of your family and the key people in your child's life by coaching and collaborative teamwork. You and your child's feedback is key to informing ongoing intervention. At Care Squared, we know that you are the expert on your child and that collaboration is key. This is also in line with the NDIS principles. Collaboration, by collaboration, we are looking at how we support you to have coordinated supports by providing an overarching assessment process versus individual disciplines, and a key clinician in your child's life, and with your permission, actively engaging with other stakeholders surrounding your child and your family. So under the coordinated care visit, what we are doing is providing you with a key clinician from day one to ensure collaboration between your goals and other stakeholders' input to help inform what intervention should look like today and in the future. So let's look at a closer look at Care Squared Kids service model, incorporating the coordinated care more closely. So the intent of the service is at Care Squared Kids is that we support you and your child whenever you're ready to start accessing therapy services. We understand that some families are accessing our service very close to diagnosis, and there's a lot of work to be done in understanding that diagnosis and how that impacts on the journey between when we meet you and when we're helping to support your child to develop their independence further into the schooling career. We also know that some people have already got identified therapeutic intervention needs, and they just want some help to work out what the best outcomes are and which are the best disciplines to provide that. So at Care Squared, we can provide you ECIS NDIS funded services if you are a support coordinator, if you're a support coordinator or yourself are managing the funds. Our services provide a holistic wraparound service to support you and your child. We understand it is a steep learning curve, and therefore, from the very first appointment, we are here to listen, but also to provide information. We are there to empower you to use that information to understand what is best for you and your child. And we are there to help guide you to determine what is the right type and frequency of therapeutic input to support your outcomes. Our values at Care Squared are around collaborative practice. We work together with all stakeholders in your child's life. This could be other family members who are key to the child's life, other health professionals previously or currently, and educators in the child life, whether that be at daycare, at kindy, prep, or further into their schooling life. We are very family-centered in that we value that families know their children best, and therefore are equal partners in supporting the learning and development of the child. We ensure we are working in an evidence-based way, and that our practitioners used evidence-based practice when they're determining the assessment type to use or the intervention that we provide, therefore providing quality care to you and your child. Therapy is interactive. We know that therapy has to be enjoyable and fun, and engage other components of the environment, including family members and what you have available in your house to ensure that you can continue therapy once the therapist leaves the room. Our purpose is to understand children's needs within their family context and natural setting. So what that might mean for one family might be very different in another family. A child's role within their family, depending on siblings and other parenting structures in place, would lead to a different way of implementing therapy. So we work within your family context and in your natural setting through using holistic, evidence-based and multidisciplinary assessments. Multidisciplinary meaning we have a number of different types of therapists at Care Squared. We have speech, we have occupational therapy, physio and psychology, and they all form part of that multidisciplinary team. Our purpose is to achieve positive outcomes for children through the delivery of family-centered intervention. And we tailor this to the individual's child's goals and their environment. We work to empower, support, and upskill families who are key surrounding the child in order to maximize children's opportunities to successfully participate in all of their environments, including home, school, sport, and their broader community. We use play-based and motivating therapy, working with you to understand what your child's current functioning and interests are, so that we have motivation internally from the child to participate in therapy, and the therapy sessions can create joy in learning new skills and routines. When we talk about a coordinated care visit, this is incorporating what we call transdisciplinary practice. So what does transdisciplinary practice mean for you and your child? What it means is deciding which service is the priority for your child can be confusing. So it might be OT, it might be speech, it might be physio, it might be psychology. You may have had different advice from different professionals about what is the priority service for you and your child. There may be many people involved in your child's life, and this can be really complicated. So what we try to do is work with you to ensure that we understand exactly what it is that you want to achieve. We integrate that expertise from physio, OT, speech, and psychology, and use their experience from these different disciplines to determine what would be the most useful assessment process for your child, the planning process for ongoing therapy, whether it be one therapist or two, or whether we have one therapist primarily and another therapist providing education and support to that clinician to ensure they're carrying through with the goals that you are wanting to work on. And we may have times where you have an OT for a period of time, and then it makes sense to move across to work with a speech. But the speech therapist will also understand what has gone before from the occupational therapy intervention to help inform the goals around communication and ensure greater success. In this way, it is a streamlined process. It's more integrated, and we have a common goals approach, which allows for a much more efficient service for you and your child. Our focus always remains the child and their family, without any delineation by therapy discipline, therefore allowing attainment of additional goals that are not normally monitored or considered if we're working in silos with just one discipline involved in your child's life. So how does Care Squared provide this? We stick true to our mission to support participants, carers, support coordinators, and the broader community by providing highest quality expert clinical health care. In Care Squared Kids, we have a 4 services pathway. The pathways are just a pathway for us to understand how to provide your service, but to provide you a bit more information so we know, you know how we are helping to guide you with making your choices. We have a transdisciplinary pathway, we have a single discipline pathway, we have a diagnostic pathway, and we also have training and education pathway. So families can access any of these pathways, and we will help you to choose which pathway is best for you at what point. Children may also move across different pathways. And what we primarily see is that families and children enter at the transdisciplinary part and then move across at different points to access potentially specifically one discipline for a period of time to work on one specific goal. We may have families that need to have a diagnostic pathway at one point in their journey with us. They've entered our organisation and having an overall assessment, an overarching goal setting process, and then further down the track it becomes apparent that a diagnostic pathway would be helpful to continue your journey and ensure the funding that you need for your child. So the coordinated care visit pathway, which is the pathway we're primarily talking about today, is transdisciplinary. We commence with at the point of referral, when the support coordinators refer across to our service, or you as the parent referred yourselves directly to our service. This is picked up by what we call our care squad. This is a trained team they understand what the services that we can offer and are trained to try and gather as much information from you at the point of referral to help ensure that the pathway is slick and coordinated throughout the time. They ask you to provide as much information as you can on the referral form. You can go to the website and that has all the tabs that we ask you to provide information so that we're capturing everything that's happening for you at the moment, what your goals are at the moment, and what has gone before with regard to previous input from different clinicians. We then have a coordinated care visit scheduled. In this appointment, you will meet with your key clinician. Your key clinician will either come to your home or do a virtual appointment in the current environment and complete a developmental screening with you in collaboration with you, knowing that you know the history of your child best. Then you walk through and start a goal prioritization discussion where you're looking at all of the areas that you've presented that are important to you and your child, what intervention you've had previously, understanding the level of funding that you currently have to provide this service, and then working out how to prioritize what is the most important thing for you to work on with your child at this time. All of this information is then taken to our team of professionals at a team conference where we look at developing coordinated goals and determining the appropriate team members and the timing of when these team members will meet with your child. All of this process is collaborative with you, as you know your child best, and you will know what is the most important goal for your child at this point in time. Once all of this is agreed, we revisit your home, talk with you and your child, and ensure that we are all in agreement around the combination of services, both individually or in teams, and the timing for that. So therapy begins in a very targeted and coordinated way. Single discipline service, as I mentioned before, some families, it is an option as well. If families are very clear on their current goals and priorities and know which type of therapist they would like to work with to support their needs, or they may have other therapists already involved in their child's life, we can also provide a more targeted single discipline service. So while you may choose to work with one discipline from Care Squared, we will still ensure that we collaborate with other therapists from other services and or educators at the Child's Learning Facility to ensure the most coordinated service for you and your family. Because Care Squared Kids has a multidisciplinary team of therapists on staff, we support you to receive different services seamlessly if your needs change over time. And we can move from a single discipline service to a multidisciplinary or a transdisciplinary service where we're providing input from other disciplines as well. So at this point, I'm going to hand over to people to ask if there's any questions. I think you can all see the chat function there. So can I ask if you are able to, if there's any questions around our coordinated care visit, or indeed around Care Squared or Care Squared Kids, our new service? No questions out there? Okay, if there's no questions, what I might do is go back and just give a little bit of a case scenario if someone was to contact our service. So sorry, we have got some questions here. So Jackie is asking, will this service be offered in Darwin? That's a really good question, Jackie. At the moment, we don't have this service offered in Darwin. However, I would encourage you to go on and put an expression of interest on the referral page on our website, as we try to respond where we can to coordinate. If we aren't able to provide that service, try to link you with a local service who can provide this service. Okay. Great, thanks, Jackie. No other questions. I might just give a quick case study around how a referral might look if we had someone come and contact our service and the child was 3 and contacted our service because they had concerns around their child's mobility, and they also had some concerns around their communication. this child is the oldest child in the family, so there's not much, there's not an older sibling to compare their developmental milestones to. However, the mum is able to say that she's noticed in her playgroup that her child's milestones don't seem to be keeping up with other children's milestones. Therefore, when we receive that referral, we would be asking whether there's need for have physiotherapy input, speech input, because we can see already that there's some difficulties in both gross motor or movement milestones, but also in speech therapy, in speech and communication milestones. So in this example, we would be looking to have a child, if they have funding to access the service, to look at how we can provide a key clinician to go out to the house, discuss and review all the developmental milestones as they have occurred to date, and then incorporating going back and talking with the speech therapist to talk with how they can incorporate their coordinated intervention. So it may be most important to the family at the moment to look at looking at early mobility goals, and we can work on those. But in a transdisciplinary way, the physiotherapist is also able to get input from the speech therapist around ways to facilitate communication within those physiotherapy sessions. It would also it'd also be important to do a more targeted speech therapy assessment to understand that the reason and the nature for the communication delay, so that those strategies that are provided by the physiotherapist and also by the mum would be very targeted to enhance the communication goals as well. And then once communication is starting to move along more steadily, there may be need to go back and revisit self-care goals to have the child get ready for kindy. And in that environment, we often would have the occupational therapist also provide input at some point, either via the physiotherapist or directly, to enhance understanding the delays around dressing and self-care, toileting, to ensure that the child is on track for that prior to entering kindy. So you can see it crosses over between all three disciplines at some point. Some of that service can be provided in a transdisciplinary way by the therapist that's already involved, and sometimes there needs to be a more targeted assessment process. Does that provide a little bit more information to people about how and when to refer? That's a great question. About if a child is over 7 and already has an approved NDIS plan, they absolutely can access the coordinated care assessment process. And this process is a process. It's not about funding. What it is looking at the needs of the child and the family. Therefore, if a child is over 7, already has their NDIS plan, and therefore has more specific NDIS goals that have already been articulated and specific NDIS lines, it doesn't take away from the fact that this child still requires an overall assessment looking at input that's required from a range of different services. So we still aim to do a global overarching assessment in the first instance to really ensure that we're making best use of funding, whether it's NDIS funding or ECEI funding. Thank you for that question. Okay, if there's no other questions at this point, I might finish up there and thank you for your attendance. And I will go back to the screen and make sure that you can see the way to refer. So we've got an online referral form, which has been updated recently, which has quite a bit more information, as I pointed out, to ensure that we have got information around your child's current age, where they're attending, the key people in their lives, their diagnosis, if that's relevant, the type of funding that they currently have, or if you already have clarity around the kind of goals or input that you would like to receive. And also looking to upload any reports if they've previously been received. That's really, really helpful. To be able to upload reports so that we're not having to revisit any gathering of information prior to actually being able to move forward with intervention. So that's on our website. You'll go to the referrals tab and click on that, and all the tabs, all the fields will drop down and you can add all that detail. The more you add, the better for us. It will streamline that intervention, especially if there's different parties that we need to contact to move forward with intervention. It's very helpful if we have all of that from day one. And you're also able to call Care Squad on the 1300 number. Once that information has been passed forward as a referral, I will personally actually pick that information up and ensure that we are putting the right person in front of you for that service. Thank you very much for your time this morning, and I hope that was helpful, and we'll hear from you either with queries or a referral soon. Thanks very much.